Well, ever since the beginning of the pandemic, there's been a renewed focus on mental health. It's been a rough couple of years for many of us that can take a toll.
We're not just talking about parenting, we're talking about teens and children as well. And it's been a topic of mind this week again with the death of former Miss USA Cheslie Kryst. And morning anchor and health reporter Kirsten O'Connor is here now asking a doctor about what parents should know.
Ask a Doctor is sponsored by Conviva Primary Care for Seniors.
So one of the things that can affect us all, but especially our kids when it comes to mental health, is sleep or lack of sleep. So I spoke to Monica Ferredo, a pediatric psychologist with Orlando Health Arnold Palmer Hospital for Children, and she says a common issue that she's seeing in patients right now is problems falling asleep at night.
Lots of it is that trouble falling asleep. So there's either, a common thing that I'm seeing is either lots of worries and uneasiness as soon as kind of the day calms down, everybody's relaxed. Not everybody is relaxed. We're having lots of those stressors about school or worries about even worrying about sleep, as well as technology. Falling asleep on watching Netflix or on YouTube or on their phones. This is something that, especially with those preteens and teens, that I've been seeing a lot, where parents are thinking they're in bed at 10 o'clock and they're falling asleep at that 1 or 2 a.m. and then waking up really groggy, really irritable. And then the big thing that is throwing off lots of sleep is, since teens are very tired, they're napping during the day when they get home from school, which then impacts their school. And then once midnight comes around, they're awake because they've powered up.
So if it gets to a point where you or your loved one needs some help when it comes to how you're feeling mentally, we're also seeing lots of people reaching out, and that means it may be difficult to get your appointment with a provider. So what if you're on a wait list for therapy, but you really don't feel like you can wait?
I will say at the beginning of the pandemic, it was very scarce. Even we weren't seeing a lot of families. We were kind of a ghost town in clinics and within our hospitals when we're thinking of mental health. However, people waited and waited, and now they're trying to get some help, and there's either very long wait lists, or they can't find providers in person, or even via telehealth. What I have been seeing on the positive note is a lot of individuals, even here in Florida, maybe working from other states, but do have their license in Florida. So I am really pushing families, whether that's child psychiatry, adult psychiatry, or any type of mental health, look at the options for telehealth as well. There's wonderful providers working out there, even though they're not in your city or in your, a few miles close to your home.
And then, of course, the headlines about Miss USA have affected a lot of people this week, and some are discussing hidden breaking points. So I asked, what are some red flags to look out for that someone may be in crisis?
And I would say one for those watching, checking in on your loved ones, even if they look like they're doing great and their life is wonderful, whether we see them online or in person, still check in. Lots of people are honest when you ask them, how are you doing? Another thing is, if you're feeling you're just not yourself, you're feeling more irritable, you're feeling more down, more anxious, ask. Even though you don't feel like, even though you're not feeling like I need a psychologist or I need a therapist, it still may be helpful, really not waiting to that point where you feel like the weight of the world is on your shoulders. It was a horrible loss that we saw, and it's something that's very difficult. One for, thoughts out for her family and her loved ones, and reaching out for, if we don't even want to tell someone that what's happening, there's lots of hotlines out there, even ones that you don't even have to call. We can even text the 741 hotline, and that's something that I often tell my teens. It's a hotline that they can just text, and someone will automatically be on there to support them and talk about it.
Now, something else that we discussed that's important to understand, if you have a friend or a loved one dealing with severe depression, it's not about just being sad. There's something not working correctly in their brains. So it's not as simple as just being positive around them or cheering up. Showing people you care about them or offering to take them for treatment to get their brains functioning correctly. That's some of the ways that you can help someone you love that's struggling. And you can find mental health resources on our website, right on clickorlando.com. In an emergency, though, you can always call the National Suicide Prevention Lifeline at 800-273-8255.